So this is a little instruction on how to use our EBM Medical. You click prescriptions to get going, and you'll notice it'll pop up your provider name. Then you click next. And I added, and this pre-populates for a whole practice, the most common antifungal things. We do have some of these in the office, so we might be prescribing them in the office, but there's some others that we don't have in the office that we might want to try. So for example, there's Tocilin, which we don't have. There's a Tocilin kit. There is this is an N45. This is an antifungal with urea. There's anti-inflammatory. The benefit to this EVA7 is that you can use it if people are on blood thinners and also people that are having shockwave. Bone healing could be post-surgical to help with healing of the bone for slow healing fractures. There's some topical wound gels that have antibiotics inside of them. There's some CBD creams. This is one that has a kind of a CBD that can help for pain. Here's one for people that have cramping, EBM8. Anyone that has like Raynaud's issues, you could do this circulation, and also there's another one for kind of Raynaud's. There's just a regular diabetic skin cream. We have some of these as well. Some of the like Amerigel Blue. We're also using this. There's one for erythrasma that you can use between the toes, for plantar fibromatosis, one that has verapamil, for hyperhidrosis. There's others that have zinc oxide and aluminum chloride, an iontophoresis patch, uh, a nail foot soak. These are the Tocilin soaks. There is those for neuropathy. There are others for neuropathy. I'm going to show you that in a second. This is the most common one, the N6. There's for onychodystrophy. This has the biotin, but we also have ours with biotin. Here is one for warts that you could use, and then a wound stimulation gel, and then post-wound nutrition. So I just picked these based on what I've seen other people dispensing in their office. Now, if you want to go to a specific one, let's say you want to do a neuropathy and you don't want the 6, there's 5 or there's 3. So there's these 2 other ones. So if you want to do the 5, for example, you can look at this one right here. So they have other things as well, some that we might not be using, like some GLP-1s, but these are all kind of inside. There's some kind of maybe some scar, anti-scar things or pigmentation. So if you find one that you want to use, what you can do is you can just click on it and you can make it a favorite and it'll add to our favorite. So if you have a scar cream, you can do something like that and then it'll add it to the favorites going on forward. So that's where you click. You just click on prescriptions and you start the prescription. And then after you pick the one that you want, what'll happen next is it'll go to the patient, ask for the patient information. You click next. You'll apply it. It'll be a 45, and you can add a couple of refills if you want. And the default pricing, we don't make our own pricing. You can make your own, but basically they make the pricing. And then you hit next, and then you put in their date of birth, their phone number, first and last name, and then they will text the patient with the information and request payment. You can save the prescription and sign it, and you do a digital signature with your mouse or your finger if you're on your iPad. You can sign it later. So that's how that works. If you want to see which patients you've done it for right here, here are our healthcare providers. If you want to learn more about the products, you can click on this one and you can go to any of them and they have instructions. And the instructions are going to open up a sheet like this that you can kind of see here. Let me just change my sharing so you can share, so I can share the screen here. So you can see here, here's the diabetic foot arbitract. So it has a little information. So you can even put these if you wanted to on Patient Education Genius, or you could give them to patients if you think it's necessary, if they want to know more information as well. Okay. So these are the products that they have. You can kind of look through them. Here's the retail. Here's the wholesale price. So the wholesale is what we buy it for. The retail is what we sell it for. to the patients. They also have a bulk purchasing order, they call it, so you can like hold inventory. So let's say we do a lot of this CBD. If we buy a increased amount of them, like if we're going to do a lot of them, you buy 24, you get it at a lesser amount, and then you can sell it at the typical amount. So you can by doing bulk, basically, kind of like a BJ's idea of these. That's so that would show your any inventory that you have if you pre-purchase. Management, offline orders, financials, sales dashboard. Um, you can also add these to the website. So it'd be possible to add these to the website. So if we didn't want to specifically do these for patients, they could go there and just put that information. But a lot of times coming from us, it gets a little bit easier, but we could add these onto one of our web pages as well for information. And then you can see here the sales dashboard. So you can see we've done 2 creams already, and they've both been filled. Okay, and that's about it to start.